Hello, my name is Julie Hebert. I'm part of the Hebert Group along with Stephen Hebert, my husband, and Jim Hall, my father. We're here to go over your LCY Elastomers group insurance benefits for the next year, beginning January 1, 2022. For next year, your health insurance and dental insurance will remain with United Healthcare and UMR, a division of United Healthcare. Your employee deductions will remain the same. Your life insurance and long-term disability will remain with MetLife as they were last year. So we're just going to briefly go over some of the highlights. One thing that's very important is that LCY is part of a PPO plan, and it's very important that you utilize providers that are only in the United Healthcare network. You can go to the UMR website and look for United Healthcare Choice Plus network, put in your information and find a provider in your area. They have a very wide network, so you should easily be able to stay in network. So you have a $700 per year calendar deductible, and you have a $2,100 per family deductible. Once you've met that deductible, you pay for your insurance costs at 20%, and United Healthcare pays at 80%. You have a maximum out of pocket of $4,700 per person, $13,200 for your family. You go see a primary care type physician, it's $30. Anything that is inpatient or outpatient is paid at 80% after the deductible. Then you have an urgent care copay of $30, an emergency room copay of $300, and then you also have to meet your deductible and pay up to the maximum out of pocket. So it's very important that you try to not use an emergency room unless it's an emergency. You have a specialist copay of $80. It's important to know that your annual wellness exam is paid at 100%. So you can go every year and get your flu shot, your COVID shot, any kind of immunizations, routine testing, your mammogram or well woman, well man check every year, and all of that's covered at 100%. You also have included a hearing exam and a vision exam included at no cost to you. And you have prescription drug coverages. Generic is $10, name brand preferred is $30 or $60, and then specialty are $100. You also have the option to do a mail order prescription service. As we mentioned earlier, an urgent care facility copay is much less than going to an emergency room. So we encourage you again to use an urgent care rather than an emergency room whenever possible. Teledoc is a feature that's available to you that you can call this, either go onto the website or call the 800 number, and you're able to pay a $10 copay, and you can have a doctor call you back and diagnose your problem over the phone. This works well for things like routine colds, maybe possibly an earache or a skin rash. You could take a picture of and upload to their website, and you don't have to go to the doctor's office for a visit. Pre-certification is required for any inpatient hospital care and outpatient services. So you want to make sure that your doctor's office goes through the pre-certification process with UMR. Also included some information here that you can go onto the UMR website, set up an account, and you can see all kinds of great information there. You can check your benefits to see what's covered. You can look up how much you've paid out of pocket. You can find a doctor in your network, and there's all the instructions on how to do that. And you can see lots and lots of information there right at your fingertips. Here's the instructions on how to find a provider, and it goes step by step to help you find someone that's in the network. This is talking about using the right healthcare setting and trying to keep your costs at a minimum. There's a nurse's line that you can call that's completely free, and that information is there. There's a teledoc service that's quick and easy, the urgent care or walk-in clinic, and there's your copay. And then if you go to the doctor's office, $30 or $80, depending on if it's a specialist or not. And then the most expensive care, of course, is in an emergency room or inpatient hospital stay. So there's something to consider whenever you're not sure where to go. This is kind of a guideline of where to go and the cost of each type of care. Here's the information on Teledoc. It gives you all the 800 number, the app, and all kinds of information. This talks about things that would be applicable to use Teledoc for. As I said, pink eye, I personally used it for pink eye for my daughter one time, and a skin rash, and all kinds of great options there for you. And it saves you a doctor's visit and time in the doctor's office. This talks about preventative care services that are covered at 100%. And there's some great things there that you can go make sure you're taking advantage of. and use your benefit that you're already receiving through your company benefits. This talks about children's and adult services. This is a information on OptumRx. That's who your prescription drugs are through. So this is telling you how to go onto optumrx.com. You can find out more information about your prescriptions. You can set up your account. Gives you all kinds of great information and gives you the lowest cost provider to use on your pharmacy, and tells you how to use the member portal. You can check and see what prescriptions you have in there. You can check your order status when you're doing an online order. This tells you pricing, lower cost alternatives. There's some great information here on the OptumRx website. And here's the OptumRx app. Of course, everyone these days has an app, so you can also pull that up and have it on your phone and have all your prescription drug information right at your fingertips. Your dental insurance is also provided through UMR. It's a PPO dental network. Again, you're going to be better off, get the most bang for your buck out of your benefit if you can stay in network with a UMR dentist. You can go and get your teeth cleaned twice a year, and it's paid at 100%. If you have to have a filling, an extract, or oral surgery, you're going to pay at 20%, and the insurance is going to pay at 20%. And if you have to have a crown or a denture, they're going to pay at 60%, and you're going to pay at 40%. And the same applies to orthodontia. There is a $100 per year deductible, but that's waived for things like getting your teeth cleaned and the orthodontia care. But otherwise, you will have a $100 copay. There is a $2,000 maximum calendar year maximum for each individual, and a lifetime maximum on orthodontia of $2,000. And that cost is included in your one low cost plan that you select for your health insurance also. LCY has a flexible spending account, also called a cafeteria plan. This allows employees to pay for their unreimbursed out-of-pocket expenses on a pre-tax basis. Some examples of these include doctor copays, prescription copays, eyeglasses, eye exams, LASIK surgery, orthodontia, etc. So you can sign up for that during your open enrollment, and you can decide how much you're going to put in each paycheck. And you can do up to $2,850 this year. And you can actually roll over as much as $570 to your Flex account and use that by April 30th, 2023. So that's a good thing that you can set aside money for. You have short-term disability administered through UMR. It's 100% paid for by LCY, and they will pay for 80% of your normal pay for a maximum of 13 weeks per calendar year. So this is a really nice benefit if you become ill or you're injured off the job. Then they also have long-term disability, which will pay up to $10,000 a month through the time that you gain Social Security retirement benefits. So once that short-term disability runs out, the long-term disability would pick up. So again, this is really important, especially when you see coworkers and friends facing, illnesses like COVID that maybe have them out for longer term than other short-term illnesses. So this is something that could help you and be a great benefit for you. LCY also provides a life insurance policy that's very generous. Each employee is insured for 2.5 times your salary, up to a maximum of $425,000. This does reduce at age 70 and then again at age 75. One thing we want to make sure is that you have all your beneficiaries squared away. If it's been a long time since you visited who your beneficiary is, please reach out to Joy. She's got a form that she can send you. You can update your beneficiaries and make sure that you have that information current and that it's available whenever your loved ones might need it. We also have an option for dependent life insurance. Employees can insure their spouse for $10,000 and each child for $5,000, and your children are covered to age 26. This is a monthly payroll deduction of $3.20 per month. It's available through MetLife. So this is a relatively low cost that gives you $10,000 for your spouse and $5,000 for each child. So that's one option that's available on dependent life. Then also in voluntary life insurance through MetLife, you can also insure yourself, your spouse, and your children for group term life insurance. So for this, you can cover yourself from increments of 10,000 from $10,000 to $500,000. You are guaranteed an issue. $100,000 is guaranteed when you're hired. You don't have to answer any medical questions. So right when you start working, you're guaranteed $100,000. And anything excess of $100,000, you're going to have to answer medical questions. And if you change from what you currently have and you're an existing employee, you would also have to answer some medical questions. You can also insure your spouse in increments, again, of $10,000 up to $100,000. And it's not to exceed 50%. So you've got to at least have whatever your spouse has can't be more than 50% of what you have. The guaranteed issue amount on this is $25,000. And again, that's when you're a new employee. If you're existing and you add some coverage for your spouse, you're going to have to answer medical questions. Children can be covered for $10,000, and this is all at the same price. You cover 3 children, 1 child at the same price, and you get $10,000 of coverage, and that is guaranteed issue. So this talks about an example of at age 35, you have $100,000 life insurance with accidental death and dismemberment. You add your spouse for $50,000, and then your children, and that shows your cost per pay period. So there's some more information. This is more information about your long-term disability plan, about your basic term life insurance, which is provided by the company. And then also, these are some services that are provided by MetLife that they have grief counseling, they have funeral assistance, they have will preparation and funeral discounts, all kinds of things that will help you. And there's some information on that. Here's some frequently asked questions about the will preparation service. And here's some more information on that supplemental life insurance about what's eligible, what's available to you, and the cost is here in this table, the monthly premium. So the month of December is your open enrollment month. If you have previously declined to cover yourself or eligible dependents, this is the time where you can make changes for whatever reason. You just want to make a change. This is the time that you want to change who you can cover. Beyond the month of December during open enrollment, these changes will be effective January 1, 2022. Any other time you want to make a change, it has to be because you had a life event, like you had a birth of a child, adoption, marriage, death, divorce, or loss of coverage with your spouse's employer. Please be sure and let Joy know within 30 days if you need to make a change due to a life event. You have a limited time with the insurance carriers to get that change completed. You're eligible if you're a full-time employee and you work 30 hours or more a week, and you've gone past your trial period, then you're eligible for benefits. This talks about some qualifying life events like marriage, divorce. We have a lot of babies being born, a lot of COVID babies being born recently. So those are common life events. This is information about COBRA. If you were to separate from LCY and wanted to continue your coverage, this is how much it would cost you each month. This talks about Medicare eligibility. If you become Medicare eligible and you have any questions about this, please reach out to us. We're happy to help you with that. This is some required disclosure about Medicaid. And I believe that's it. The most important thing is to know that you have great benefits with LCY. They do a great job of offering you guys great coverage and really take really good care of you guys. If you have any questions at all, please feel free to reach out to myself or to my husband or my dad. Our contact information is right here on the front. We'd be glad to help you anytime. And if you have any questions, please don't hesitate to ask. Thank you so much.